Women in general tend to have a higher tendency for what we say non-classic symptoms. And these could include unusual fatigue, which is actually very common. For instance, a woman has been easily able to climb a flight of stairs, and now out of the blue, she struggles to do that. Then definitely underlying heart disease needs to be ruled out.
This is the Transformational Life Consulting Podcast with Deepa Grandin, MD, where Christians like you get the practical support and tools you need to build your spiritual, mental, and physical well-being, and to guide you on your journey to health and wholeness based on evidence-based science and God's Word. I am your host, Dr. Deepa Grandin.
Today's podcast is Heart Health in Women. According to the World Heart Federation, cardiovascular disease is the leading cause of death for women worldwide. 1 in 3 women around the globe dies due to disease of the heart and blood vessels, yet only around 50% of women under the age of 55 who had a heart attack were aware that they had factors that put them at risk for heart disease. Women can have cardiovascular disease at any age, especially if they have risk factors like obesity, hypertension, but are especially susceptible during pregnancy and menopause. Often women are underdiagnosed and undertreated due to misconceptions in the general public, as well as among medical providers, that heart disease is uncommon in women. While I was in medical training, I was taught that cardiovascular disease was more common in men. This misinformation has partly contributed to the underrepresentation of women in cardiovascular research. So let us start with some basic definitions so we're all on the same page. What exactly is cardiovascular disease? Cardiovascular disease is an umbrella term that includes diseases affecting the heart and blood vessels, of which atherosclerosis is the most common cause of death in both men and women. So then what is atherosclerosis? Atherosclerosis is a combination of fatty substances, cholesterol, cellular waste products, calcium, fibrin, which creates this hard substance called plaque. Plaque causes your blood vessels to become narrow, making it hard for blood to flow through. In instances where there is complete blockage of the arteries, it can cause heart attacks and strokes. What are the differences between men and women regarding heart health? 1 is their anatomy or structure. For instance, women have smaller blood vessels and heart chambers with thinner heart walls. The smaller size makes it easier for the heart muscles to have more significant damage to the heart walls with minimally blocked arteries. While classic symptoms of heart disease, such as chest pain, chest pressure, shortness of breath, these are commonly experienced by both men and women. But women in general tend to have a higher tendency for what we say non-classic symptoms. And these could include unusual fatigue, which is actually very common. For instance, a woman has been easily able to climb a flight of stairs, and now out of the blue, she struggles to do that. Then definitely underlying heart disease needs to be ruled out. Other symptoms like shortness of breath, feeling dizzy or faint, feeling hot or flushed, indigestion, fast heart rate, numbness in the hands or fingers, nausea, vomiting, loss of appetite, vision problems, which are new, having constant horrible headaches, incessant coughing, a choking sensation. All of these should motivate a provider or even family members to get the loved one checked out for heart disease. Now let's talk a little bit about what makes women more at risk for fatal heart disease. As I described to you earlier, women tend to have smaller blood vessels. So they not only can develop blockage in the main arteries in their heart, but also the smaller blood vessels. We call this microvascular disease. This is much harder to identify through standard tests that are available in most treatment centers. Also, given the smaller heart chamber size and thinner walls, some women can have heart attacks even without severe blockage in the arteries. This is known as non-obstructive coronary artery disease. Other conditions such as menopause, hypertension during pregnancy, diabetes during pregnancy, commonly known as gestational diabetes, polycystic ovarian disease, autoimmune diseases such as rheumatoid arthritis, lupus, peripartum cardiomyopathy, which is a disease of the heart when an individual is pregnant, and the use of oral contraceptives puts women who have had these conditions at a higher risk for having heart disease. Women also tend to have more fat cells and hence have a higher tendency for obesity and metabolic syndrome. Metabolic syndrome is a condition where you have the coexistence of high blood pressure, obesity, high glucose, and triglyceride levels. Women are also more prone to the adverse effects of smoking, diabetes, and hypertension. In fact, women with diabetes have a 2 to 4-fold increased risk of developing heart disease than men with diabetes, and they often die after their very first heart attack. Women over the age of 60 are more likely than men to have high blood pressure, which is less well controlled. The reason it's not as well controlled is partly because women have a more challenging time tolerating medications, which makes them less inclined to want to take their medications. And they're also more sensitive to sodium, as tiny amounts can cause their blood pressure to rise. They also have a tendency for high C-reactive protein, which is a marker for inflammatory process in the body, which along with the other risk factors is also a sign of possible heart disease. So when should a woman actively seek medical evaluation for heart disease? If you or your loved ones have any of the classic risk factors that I had listed, like diabetes, high cholesterol, high blood pressure, obesity, most definitely you need to be screened for heart disease. Also, women who suffer from depression and anxiety are more prone to having heart disease, as often they find it hard to be motivated to follow lifestyle advice for disease prevention. So what can you do on a day-to-day basis to protect yourself and also to offer advice to the people around you to protect their heart? In my 6 Pillars video, which you can access on my website, www.drdeepa-dlc.org, I discuss various intentional lifestyle choices scientifically proven to support heart health. Please take some time to review this. Some well-known lifestyle strategies include quitting smoking, eating more natural, unprocessed foods, exercising and maintaining a healthy weight, managing stress, avoiding or limiting alcohol, and avoiding recreational drugs. In conclusion, if you or your loved one is at risk for heart disease, find a provider you like and trust and carefully follow their guidance. Utilize lifestyle health coaches who can help you stay the course and overcome mind blocks and self-limiting beliefs. If you need coaching or advice, please feel free to contact me. You can book a discovery call with me and plan your next steps to achieving a healthier tomorrow for yourself and your loved one.